Alison has over 20 years of experience working with government and nonprofit agencies at local, state, and national and international levels. She's become a seasoned professional in managing grant programs and educating professionals across the country on problem gambling outreach, education, and prevention evidence-based practices. She assists organizations on how to evaluate and expand programs, increase awareness and impact. She is the North Carolina Problem Gambling Program Prevention Coordinator with our company, Morneau Chappell, and she manages over 60 statewide prevention grants, speaks at conferences and webinars to educate attendees on problem gambling prevalence rates and best practices in prevention, outreach, and education. She trains and provides technical support to school staff and prevention coordinators on Stack Deck, which is an evidence-based prevention curriculum. She also holds a master's degree in social work and a master's degree in public administration from West Virginia University. You know, I work with Alison. I consider, you're my partner, Alison. We actually do trainings together in North Carolina. And when Kelly Gage came to us and talked to us about doing some type of community outreach, I thought it was a great idea, but I don't mind saying, I think it's important to know what you do know, but it's even more important to know what you don't know. So this is our subject matter expert on this, and I look forward, and I learn from Alison all the time. And Alison spoke last year at the national conference and did such a great job. Are you speaking this year in November too?
I think so. I think I'm still on the
Yeah.
agenda, but I know that
Okay.
they switched to the date of the conference, so I'm going to kind of wait and see.
Okay, so Alison, you know, Alison, and you took over from Ashley, right? Right after was it?
Yes,
Yeah.
Ashley
So,
Trantham, who
yeah.
did a remarkable job.
Yeah.
Then I took over as she moved up in Morneau Chappell.
Yeah. So she's now our supervisor. So Alison had some big shoes to fill, but she's filled them. I got to say, great. So, and it's great to work with you. And without further ado, I'll shut up now.
Thank you, Robbie.
Cool. Yeah.
Well, I'm so glad to be with everyone here today. And today, these are the learning objectives that I hope everyone goes away with after this. Is, you know, I want you to just think about and learn about the guiding principles and problem gambling interventions. I want you to be able to start talking about different types of outreach efforts. Maybe there are some that you've heard before or implemented before, and maybe there'll be some that'll be brand new to you. I want you to start thinking about that assessment phase, because really that's the beginning. And of course, we don't have more than an hour today, so we're less than an hour now. So I think starting with that assessment phase and really just processing that is really important. And then really starting to understand the importance of collaboration and outreach. Many of you, I'm sure, still do collaborate in many ways. But maybe I'll be opening the doors to some other possibilities for you today, which I hope that I am. Also, I wanted to make you aware that we are going to be doing some poll questions, and I'm also going to ask for your interaction. So there are 3 different times when I'm going to ask questions of the audience. And you can please use the chat box if you'd like to answer through the chat box, but also I'm going to ask Robbie to look for those hands being raised, because I'm hoping that maybe a couple of you want to unmute and vocalize some of your opinions on those questions. But also, if you do have any questions during the presentation, you can, of course, put them in the chat box. When I take a moment, I'll look over to see if there is anything there. However, we can also save that time for the end. So let's get started. So these are really important points to remember. I think that when we engage in any type of learning activity, we are inundated with a lot of different information. And it's important to have some takeaways. So as we walk away, we say, these are some really important things that I learned. And this is what the presenter said that was the most important. So the 2 most important things that I hope you take away from this, and I'm going to point them out as we get to them, are the guiding principles to problem gambling interventions, and then best practices in developing your outreach program. So when we get to those, again, I'll point them out and I'll say, this is what I really want you to remember. All right, so here's the first question that I'm asking everybody here today. And again, you can use the chat box or raise your hand, and you can do that by going to your screen and clicking on the little hand icon. What does outreach mean to you? And when you're talking about that, think about possibly the outreach endeavors that you've been involved in. Maybe it's something that you're currently working on. What were the different components for outreach for you? I know in North Carolina, when we're talking about outreach, we're really looking outside into the communities and figuring out ways to reach out to them. Okay, here we go. Sandra Dubson says, talking with other individuals that could benefit from services your company provides. Julie Hans, connecting with community members, meeting them where they are instead of trying to get them to come to me. Good. Michelle Blankenberger, addressing individuals' needs in the community. Increased awareness about, oh, wow, you guys are doing great here. Need to keep up. Bridget, increasing awareness about services. Jennifer, to go out and educate people on the services our agency provides and make aware of gambling and substance use disorders. Ellen, identifying the population you would benefit. That's a really good one, Ellen. Kelly, the purpose of outreach is to reach more and more community members. And Christine, outreach for us is presentations on our programming to community members, as well as reaching out to clients who are community and providing information. All great stuff. That's really great stuff. You got some components of really some impactful outreach there. So let's look at this. So when we're talking about outreach, you know, we're talking about being mobile. We're talking about being in person. And then, you know, what are the different tools that we use for outreach? Sometimes it's leaflets and newsletters. Sometimes it's events. Maybe it's a website. Maybe it's social media. And what do we do, you know, when we're engaging, you know, in that outreach? We're hoping that we're raising some awareness and educating. We could be, you know, targeting a specific underserved population. And we also have to think about not just individuals in outreach, but communities and organizations. But here's a really impactful sentence here that I really want to resonate with you. An effort to bring services or information to people where they live or spend time. So I know, you know, during COVID-19, for example, we're spending a lot of time at our desk. And for me, I've been, you know, part of my role in prevention for the North Carolina Problem Gambling Program is getting in my car and going to those schools because they're implementing our curriculum. So I'm going to where they are so I can watch them teach the curriculum and provide feedback. But how about you? Just this is a reflective question. What do you consider when you're doing outreach? You know, what has been traditional outreach for you? Just think about that for a second. Because I think more and more of us need to get up from behind our computers and go out into the communities and figure out ways to really touch those individuals, those communities, and those organizations to help make a greater impact. And I'm sure many of you already do this in such amazing ways. Okay, so this here, we are now at that point where I'm telling you, this is one of those things that I want you to remember. So we're talking about guiding principles and problem gambling interventions. And the first guiding principle I really want you to think about is the public health policy framework. So when you're taking that public health policy lens, I want you to consider not just the individual, but we're considering the family and the community, okay? And you also have to consider those social determinants of health, okay? So that's the first factor, is what's playing into, you know, what's going on, not just at the individual level, but the family and community level. But then we also have to take into consideration vulnerable populations, populations that are more vulnerable than others because of certain risk factors. Okay, so that's what we first have to take into consideration, okay? So then we have to also take into consideration a biopsychosocial plus theoretical framework, okay? So when we're taking that into consideration, we're looking at just not, you know, a biological sense. We're taking into consideration environmental and psychological sense, and how biological, psychological, and social perspectives are interconnected and interdependent. So the public health model and the biosocial model play well together. because we're looking at not just what's going on, again, within the individual, but within the entire framework of what surrounds that individual person. So we also have to take into consideration risk factors and protective factors, okay? So, risk factors are biological and psychological characteristics of an individual, family, culture, or community that make him or her more susceptible to mental health disorders. So let's just take, for example, a child, their personality traits, maybe an undiagnosed mental illness. Then we're taking in factors that affect the child, such as maybe parental neglect, limited or poor supervision, maybe friendships with those who use substances, maybe they live in poverty, and there's more access to drugs in their community. So we're taking into consideration all those risk factors. Well, protective factors include those qualities of an individual and their surrounding environments that enable them to develop coping and adaptation skills necessary to make challenging life situations and transitions, okay? So when we're looking at protective factors, you have to consider the person's self-image, self-control, and good social skills, but also we have to look at the family, school, and community levels. Do they have positive parental role models? Do they have positive school role models, okay? Maybe they have positive mentoring relationships. Maybe they participate in after-school activities. Maybe there are policies limiting substances available in their neighborhood. So all of these factors that play in. So when we're thinking about any type of outreach, we have to look at this, these guiding principles and intervention and realize that this is really a multifaceted approach. When in order to create behavior change, because that's what we want to do ultimately, we have to look at all of this and how the risk and protective factors are at play, utilizing the public health policy framework as well as the biopsychosocial theoretical framework. Okay. So when we're doing this, we realize, you said, wow, Alison, that's a really big kind of guiding principle to kind of take in. How can I just do this all by myself? Well, the answer is you can't, but the other answer is we have to start looking at cross-sectional collaboration. So I want you to look at this definition. It's working across boundaries and multi-organizational arrangements to solve problems that cannot be solved or easily solved by single organizations or jurisdictions. That's interesting. Cross-sector collaboration is a more efficient and effective way of providing services to individuals and families with complex needs. It is widely accepted that collaboration can achieve outcomes that are more effective and efficient and sustainable than can be realized if organizations work alone. So I think maybe some of you are thinking about this, I do this all the time. And maybe some of you are thinking about some of the constraints. Maybe there are some relationship challenges that you see, resource challenges, organizational challenges, like, well, what if we don't have a shared mission? What if there's different cultures? How do we get buy-in? And how do we communicate this? How do we even start this process? So, the why, obviously, as we're talking about, is we don't have to look towards organizations to have similar missions as ours. We have to look towards organizations that we know, and we're looking at those risk factors, back on that slide where we know that they fluctuate developmentally, but we also know that risk factors are common among different disorders. So, and if you see here, again, it talks about the need and the why, because we have all these different types of problems and issues, but similar risk factors, but also similar protective factors. So we have to look at it. These problems are influenced by a variety of social, economic, environmental, and biological determinants, okay? So we have to look at it in that way. So maybe it's not a shared mission, but maybe it's a shared goal where we're trying to reduce risk factors and promote protective factors using that public health lens of the biopsychosocial framework. And where do we start? Let's just think about comorbidities, for example. The comorbidities and this specific research article, and I'm sure there's many that could be listed here that are not, but this is just a start. Those with mental illness, substance use disorder. We know that the prison population has high prevalence rates. We know that there's homelessness due to problem gambling, family violence, unemployment, suicide, all of these comorbidities. So I want you to, again, think about maybe the organizations that are just, down the street from you have a different mission, but they have a same goal. And we know through comorbidities that these individuals working in these organizations may not even realize that problem gambling is a comorbidity to start with. So this is a place to even just start, that someone, with these other disorders or issues in their life could also have a gambling disorder. But what about just within our own organizations? Where do you sit? Does everybody in your own organization work cross-sectionally? So that's even a start. Okay, so we've been introduced to this cross-sectional collaborations and principles, but we also have to think about how do we even start this and where do we start this? And this is an example of just a framework to use. So you have to assess. So you have to even understand what's going on in your communities. You have to prioritize because you know that you can't tackle everything. And you have to figure out what are the risk and protective factors. So you have that targeted population because you want to create behavior change. And in order to do that, you have to do a needs assessment to understand what's going on, within your region, if you're in a region, or within your smaller community, if you're in a community, and then you have to prioritize. But then you have to figure out, how am I going to build capacity and resources and readiness? Or how am I going to even get people to understand that they need to do that? And then, of course, there's the planning stage where you're selecting your interventions, you're implementing and building capacity and support, you're carrying out your interventions, you're making sure that you're going towards fidelity if you're using something evidence-based, and then you're evaluating. But then look down at the bottom. You have to make sure cultural competence and sustainability is there in what you create. Let's talk about the assessment phase of planning. So you have to go to that cross-sector collaboration and figure out, where is it within the assessment phase of planning? Is your cross-sector collaboration, does that need to be in the beginning? Does everybody in the problem gambling world work together, first and foremost? Or do you have pockets within your organization or within your organization and other organizations? How can you get the problem gambling world together first? But then, how can you get other avenues within your organization? So Marie just, I saw this quick question. She said, what would you suggest while COVID-19 is going on? Well, I have to tell you, what I've experienced is that there is a lot of opportunity to reach out to people and engage and figure out what are the collaborations and also the committees, who are the key leaders that you need to reach out to and schedule Zoom meetings. And I know that a lot of us feel a little zoomed out, but I have to tell you, it is a perfect opportunity to just start relationship building, and maybe even just having a couple slides on problem gambling in order to kind of raise that awareness. And if you'll find champions within those pockets, because I certainly have, and those champions will help guide you. So that's my suggestion during COVID-19, is use it as a relationship building time. So also, it's a time for you to start engaging. Maybe your leadership isn't on the call today. Maybe you can start talking to your leadership about the importance of cross-sector collaboration. You know, you have to think about who you have relationships with, who you need to create relationships with, and then where are they located? Now, obviously in COVID-19, we can schedule the Zoom meetings, but where are these different entities located? And, you know, once we start meeting again in face-to-face interactions, where are these individuals located? And how can we create the best possible way to get people together? And then here's the key, is the joint training, because we all have to be on the same page moving forward. So where does that cross-sector collaboration fall within, you know, collecting that data, doing your needs assessment? What data do you have available? Maybe it's the YRBS or the BRFFS or other forms of data that are just available in your community or region. Data is also about, you know, talking with key informants and focus groups. Once you start asking people's opinion, once you start engaging them and building those relationships, connections will start to come out, information will start to come out. You know, and prioritizing those problems, because you're going to find several different problems, you know, and then you're going to have to figure out, okay, what do we want to tackle? Because you can't just tackle everything with one outreach endeavor, because that's not going to work, because what you want to come out on the other end is a behavior change. And if you're trying to tackle it all at once, well, that's just too much. And then you have to look at those protective and risk factors, as I keep, you know, kind of drilling home there. Okay, so we're ready for our poll question number 1. Robbie, I'm going to let you launch that.
Cool. Yep. So poll question number 1 asks, what is cross-sectional collaboration? Alison just spoke on it. Is it A, working across boundaries and in multi-organizational arrangements to solve problems that cannot be solved or easily solved by one single organization or jurisdiction? Or is it B, working in multi-organizational arrangements with only those organizations with a similar mission? Is it C, working in multi-organizational arrangements with those who are willing to share a common goal? Or is it D, both A and C? So what is cross-sectional collaboration? I think it was about 4 slides back. So we'll give everybody a minute to answer. We're at 65%, coming up at 50 seconds here. So
Looks great. Looks like we're coming in here.
Thank you, Marie. Yeah, if you're unable to answer, thank you, Kelly. You can answer via text here. We'll give it about 10 more seconds. We're at 83%. Okay, I'll end polling and launch the results here, Allison. There you go.
All right, thank you. Okay, so, you know, obviously if you answered A, then you are partly correct there, but we're also saying yes, it is A and C, because we have to realize, again, reinforcing this, that, you know, we don't have to have a shared mission with an organization, but we have to be willing to share a common goal. And that takes relationship building and, of course, cross-sector sectional collaboration. So thank you, Robbie. All right, so let's move right along here. So when we're looking and prioritizing, you know, we have to also consider the vulnerable populations according to research that we know that are out there. So when we're identifying what target population that we want to work with, that could be in one of these, you know, youth having these vulnerabilities just due to, you know, their maturing brain, underdeveloped mechanisms of self-control, you know, sensitivity to the effects of neurotoxic substances, those kind of things. You know, older adults, they're on fixed incomes, you know, many times retirement funds, and, you know, a lot of research is indicating that older adults gamble, spend more money on gambling than they do going out to dinner and the movies. You know, of course, we also have to consider genetics, that family history, who else is presenting with an addiction or mental health disorder. And then, you know, the social demographics of ethnicity and culture. You know, research is definitely showing disproportionately African Americans, Hispanics, Asians, American Indians have higher prevalence rates. And even more so, they're really pointing towards African Americans having even higher prevalence rates. So we have to really take into that in considerations. Gender, we know that males gamble more than females. However, we know that that gap is starting to close. You know, special populations, for example, when we look at the military population, there are, you know, higher prevalence rates. For example, one research reported that 33% of substance abusing veterans met criteria for pathological gambling, which we know is gambling disorder now, once called pathological gambling. Comorbid and psychiatric disorders, we know that anxiety, depression, substance use disorders, all those things are certainly at play with comorbidity. Types of gambling, you know, there's certain types of gambling they say could possibly be more addictive. We're talking about high frequency betting like slot machines, or possibly online betting because the ease and access to that 24 hours a day. So we have to take into consideration these vulnerable populations also when we're looking at that targeted information. And then when we're looking at those risk and protective factors, for example, here's an example of risk factors and taking into consideration youth. And as you see here, it's blocked off into biological, environmental, and direct is what this specific researcher blocked them off as. So, you know, you have those cognitive distortions or myths that a lot of those living with a gambling disorder can experience. So it's building that awareness and lack of knowledge of just educating and empowering them about, you know, the house edge or, you know, the odds, those kind of things. And then, you know, those environmental factors in which youth grow up in, you know, abuse and neglect. Maybe there's a parent that's gambling in the household. Maybe there's just a lot of societal acceptance. Maybe that individual is low income, low education. Maybe they live in a high stress and low support environment. Maybe there's some unsafe gambling going on. Maybe there's, obviously with youth, all gambling is illegal, but maybe that there are different types of gambling going on that are not regulated. And then the biological factors, you know, we have to look at those genetics again. But then when you look on the other side of the protective factors, you also need to take into consideration all of those different levels again. And, you know, when we're talking about behavior change, we're talking about trying to combat risk factors with protective factors. So to create behavior change that's long lasting, we have to figure out, okay, what cross-sector collaborations that we can create that can help with multiple risk factors and multiple protective factors. But also we have to consider, where are we on the continuum of care? What outreach do we want to engage in? Is that part of having conversations with the larger problem gambling community? What is the focus of the overall problem gambling community in your state, and can you come together? Is it prevention? You know, is it universal to everyone, or are you going to be selective or indicated on populations that may be already affected? Or are you talking about getting people into treatment or keeping people in treatment? Or how about recovery? You know, are you going to focus on those in recovery, hoping to give them some kind of targeted intervention to help them? And then the actual interventions. You know, there's interventions not just at the individual level, but we're also talking about the family and peer level. We're also talking about, you know, institutions in the community, those rules, regulations, and policies at the institutional level that, you know, affect an individual or family. And then we're talking about the community, you know, the relationships and standards and networks in the community, and then even to local, state, and federal policy laws. So what interventions are even at play? And what's the end result? What's the behavior change that we want to create? And I'm going to give you an example here. Okay, so this is a quick example. If we're just talking about policy initiatives, say in the problem gambling world in your state really wants to focus on policy initiatives. And we know that policy creates the greatest change in communities. So you're looking at restrictions on availability of gambling. Maybe you're only going to limit a certain amount of gambling establishments in your community. Maybe restrictions on who can gamble. Like, for example, A casino only wants people coming out of state to gamble, or not, they only want people gambling within their community. Restrictions on how gambling is provided. Maybe it's only provided during certain hours, or it doesn't have certain types of gambling effects within the gambling, or restrictions on advertising. So if we look at this specific example, what you can see here is in this community, they realized before they could even get to the policy initiative, guess what they needed? They needed their outreach and awareness group, because they needed to figure out how, what target groups that they needed to even educate. And as we know in the problem gambling world, we are at a point where we're educating, building awareness, because there's so many communities, so many organizations that don't even realize that gambling disorder can even become an addiction. So here you can see the model where they're raising awareness to different target groups, okay? And the why, how are they doing it? What are the outputs in this? So they know that they need to do workshops and presentations. You know that they are talking about gambling harms and starting to introduce the idea of policies. And then their outcomes, you don't see the outcomes saying, okay, this policy initiative is passed, but they're just at a building stage here where they're realizing that they need just the willingness for people to discuss the action, to discuss the policy. And it was the outreach that helped them even get to that point where now they can move forward and begin understanding and sitting down to talk about policy. So what are we talking about with our outreach to, approach to outreach? So we know we have to look at our evidence to see what has worked. We know we have to talk about collaborations. So then we have our outreach and education, which hopefully is followed by an intervention. Okay, the purpose of the outreach and education is to have an intervention and then you have behavior change. So this is kind of what we need to think about in terms of how we need to process how we're going to engage in outreach and education, and then what our partnerships are. So what are the different types of evidence? I think that's really important to reach out, because so many times I think that we're only just looking at, these empirical evidence, okay, which is the published results of empirical studies. But we know that so much more research needs to be done in our field and in many fields. So we also have to rely on theoretical evidence, based on published theory, like theory, some aspect of human theory explains some aspect of human behavior or performance, and it allows us to make predictions. How about expert opinion? Based on those experts, I think that's important to look to their opinion. Also, practice-based evidence based on professional practice experiences, and then normative evidence based on professional values and principles. So that's a lot of different evidence that we can look towards to start building what our outreach and education will look like, and what do we attempt to try, and what do we change along the way or evaluate at the end and realize that we need to do something differently. So I think that it's important that when we understand evidence, that we're not just saying these empirical studies, because we have to be the game changers. We have to be the entrepreneurs in our field, moving forward with practices that maybe do need to be engaged with a researcher to show those results. But it's important that we know that we have all those different types of evidence. And those collaborations, when we're talking about cross-sector, I think that we also have to think about all of the different people that are going to be using this information. If we're talking about outreach and education, we have to understand that the message that we're trying to send, is it getting to the right people, and do they understand it? So not only are we talking about nonprofits and government organizations, but we're also talking about community members. Maybe those knowledge users that are actually going to be using the information, do they think that it even works? How about key informants? Those people that are all engaged in putting this together, gatekeepers, researchers, leaders in the community, all these people, and also your target population. You have to take that into consideration when we're talking about our outreach and education. All right, Robbie, I'm ready for poll question number 2.
Cool. Okay. Poll question number 2 reads, and it's a true or false. It asks, it is important to utilize only research-based practices when developing an outreach plan. Is this true or is this false? It is important to utilize only research-based practices when developing an outreach plan. Mark A if that's true, and B if that's false. Thank you, Marie. Thank you, Kelly. Oh, good. We're already at 75%. Let's see if we can get to 90%.
Looking good.
Yes. Oh, 88%. So just 2 more percent. I think we'll get it. T minus 5 seconds. And then I will share the results here. Okay, Allison, and here are your results.
Terrific. Okay. So the answer is false. So it looks like quite a few of you got that. And it's okay if you disagree. That's fine. But, you know, I think that we just have to keep looking towards, you know, realizing that there's a limited amount of money for problem gambling research, and that, you know, sometimes we have to think outside the box in order to come up with a great strategy. So when we're thinking about different types of evidence, you know, SAMHSA here provides some great ideas for outreach strategies. You know, what outreach strategy we need to pick within a community in order to get to the end results. And many times it's meeting one-on-one with public opinion leaders. Maybe it's a task force that works really well in the community, and you know that they have relationships throughout the community. So coming to that task force, doing a presentation, and then asking their opinion. Maybe it's convening a focus group, which actually is one of the most excellent ways to get people engaged, because you're asking their opinion and you're building the relationship, and then you're figuring not only that, but when you're convening a focus group or community forum, you're getting to the bottom of something. You're getting that anecdotal evidence that maybe you have some data, but then the community members can back up that data or give you some different information about that maybe isn't even in the data. Hosting a community event to share information, you know, about problem gambling, maybe to start building relationships and getting people talking about it. And then, you know, sharing information on websites, submitting articles to local newspapers, I think are also really great ways, but I think they're tools. I think that goes back to what the definition of outreach that we looked at the beginning is, that these are tools that we use in our outreach and education strategy. Okay, so you have the outreach and education strategy, the intervention, and the behavior change. So these are tools that we use to get there. So when we're talking about information and awareness campaigns, I think there are also great, excellent tools that need to follow up with that in-person, face-to-face, in the community type of touch. And here is some information about different awareness campaigns and what they've done in the past. So Indiana, for example, they implemented a statewide awareness campaign, you know, with radio announcements and billboards and brochures, T-shirts and press conferences. And what they found is that 8% of the general public recalled seeing or hearing any advertising. However, 8% of that 8%, 72% reported that the advertising had increased their knowledge of problem gambling. So that means that people who are asked to view information increase knowledge. Okay, so Victoria Department of Human Services in Australia, they initiated a statewide problem gambling awareness program. Television advertisements, radio announcements, and what they found, it helped increase collaborations and calls to their helpline. And then a follow-up campaign in Victoria several years later, they reported 70% increase in calls to the helpline and 118 increase in clients presenting themselves to treatment. So that's great research, because it shows us that those campaigns can get increased to helpline, can get increased to treatment. But there's other things that I really want you to think about is people who are asked to view information really increase knowledge. So how are we going to ask people and get them engaged in increasing their knowledge? And what's that target population that we want to do that with? And then the increased collaborations, which is great. And then no direct evidence, the effectiveness of awareness campaigns as primary prevention has a lot to do with the lack of research, I'm sure, as well. But that also means in primary prevention, if we're doing an awareness campaign, that we have to figure out what is that intervention following with the primary prevention. You know, what is that we're doing in the community, that we're raising awareness about problem gambling, and you know, what is that intervention following? Short duration presentations are also really excellent tools. Some research here on these various types of short duration presentations did not show that there was a change in behavior following them, but certainly there was a change in knowledge and attitudes and beliefs. So short duration presentations are, again, a part of our strategy. Significant part of our strategy, because we do want to get information out there, but we have to realize, again, it's not just the one strategy that we should be using. Okay, so I'm going to briefly talk about a few different outreach strategies that have been done here, and I know there's many more, but these are the ones that caught my eye. So I'm going to start off with problem gambling outreach for older adults, and what they did here is they put together just best practices on how they should even do outreach. So I thought this was very interesting to share. And this is kind of the route that they took. They did a literature review. They reviewed their survey findings, which involved, you know, key informant interviews. And they started looking at what best practices were out there. And this was specific to prevention work, by the way. So, you know, they have this preliminary draft, but look at all the different users that they engaged in this: the informant user, the knowledge user, and they engaged a research team and a treatment team. So it touched all these different groups of people, which is really important when trying to figure out best practices, because remember, we're looking at all those different ways that we can look at evidence, and we have a lot of different people that are experts and a lot of different people that have knowledge that can help us come up with those best practices. And then, you know, at the end, the actual best practices. I just want to list them out here for you. So for older adults, they realized that older adults, as I'd mentioned, are spending more money on gambling than they are in other ways. So they wanted to find a way to offer other options. They need to balance gambling with other activities, which is important. You know, if in communities there's only an opportunity to go to a casino, for example, which is casinos heavily market to the older adults, but also that is, you know, one of the popular choices for older adults is to go to a casino. You know, they knew that they needed to educate, because, you know, some of those cognitive distortions and myths, that's really important, because we want to educate people on, you know, what are, you know, those myths of gambling. Talk about warning signs and risk factors. You know, try to destigmatize some of problem gambling and comorbidity. But they actually looked at development and implementation, and they used a theory of behavior change, the trans-theoretical model, which efforts to change behavior need to be client-centered. And we're taking into consideration pre-contemplation, contemplation, preparation, action, and maintenance. So what stage of behavior and how do we engage people where they are? Selecting theories based on a target audience and what influences their gambling. So that target audience, again, is so important, okay? And then, you know, involving stakeholders, decision makers, and researchers, they realized is so important. And that the awareness campaign should run for an extended period of time with consistent core messages. So what's the information and delivery, okay? Where's the information going to be put? Where are the gambling products are going to be your gambling products? Are you going to educate responsible gambling staff? Because remember, if this is targeting older adults, we need to target casinos, because that's a very popular place that older adults gamble. Possibly, you know, venue pamphlets and other education. What about the actual information? Okay, so We looked at that continuum of care, remember, from prevention, treatment, then into recovery. You know, you need to cover each stage of that continuum, because if you send a message to someone, you know, that's prevention, but they're already, you know, could be diagnosed with a gambling disorder, then you need to target the message to them. It needs to be accurate, accessible, and easy to understand. I think so many times I read things and then realize that you know, that I didn't understand what I just read. And it's important that we make sure that we do that. And then using multiple initiatives. One initiative is just not going to work. We have to have a multi-pronged approach. What are the formats? You know, what's appropriate for older adults? Some may prefer personal contact. The print materials, for example, if it's all in, you know, really small print, are they, you know, many older adults have readers or have other types of visual needs. And what if it's small print and they can't read it? If it's simple website information, do older adults go to websites more often? Is the signage visible enough? Audio visuals designated for older adults, all these considerations. How about style and language? Is the language set for the right audience? Is that group of older adults you're trying to target, are they diverse? What does that group look like? The target audience, enhancing existing maybe awareness campaigns that you already have. Maybe you need to target certain vulnerable times for the group. But what about their loved ones? The people that care about them, do we need to target them as well? And then do we need to make sure that those messages are actually sent by older adults, somebody in their peer group, that they're more apt to listen to and understand? And then because we're talking about casinos here, they know that they have to engage just not staff training, you know, but also start to engage in some of the policy education and how to train staff. So I thought that was really interesting, the types of best practices they came out with just to educate and outreach and education. So here, we all know the American Cancer Society, other organizations have done a really great job of outreach in terms of just education, but also getting people into screening. And I thought that this was really important to make note because of how they do. But the two things that I wanted to point out here are culture and literacy. If we don't understand the culture, then we're not going to be able to deliver a message that's meaningful and something that they will be a part of. So I think that's really important to understand when we're talking about messages, but also the literacy, the degree in which individuals can obtain and process and understand health information, you know, making sure that they understand what they're reading is so important. And we know that, you know, a lot of people understand the importance of screening today. That's because many organizations have done such a great job of their outreach and education to make people aware of that. And then there's the outreach to Aboriginals in Western Australia. I thought this was also very interesting because they just wanted to understand what was going on in Western Australia. And they wanted to start working with the workers in that area to even get them to start doing outreach. So they needed to figure out, you know, what was even going on in Western Australia. And they figured out through community forums, you know, blocking out and realizing history of gambling in communities. They started training Aboriginal workers for outreach, which created, you know, those partnerships, mutual learning, shared ownership. So I thought that was very interesting, that was their focus, just to get to the point where they understood what was even going on, and then just to get the outreach workers to the point where they were even aware of the comorbidities associated with problem gambling, or that gambling could even be an addiction. And what they found through the community forums is a lot of different gambling was going on that they weren't even aware of. So I thought that outreach was really intriguing because it was just like a step one. How do we even get to the point of where we can talk about interventions? All right, Robbie, I'm ready for poll question 3.
Cool. Okay, our last and final poll question for today's webinar. And it is another true or false. Let me read this correctly. Outreach plans should accompany interventions with the primary measure of behavior change in the targeted population. So there shouldn't be a question mark there, right, Alison, I think?
Or a period. It
Or
just
it
should
should be a
say
period,
that.
yeah. So just disregard the question mark there. So outreach plans, is this true or false, should accompany interventions with a primary measure of behavior change in the targeted population. Is this true or is this false? And we're right at 56%. Thank you, Marie. Outreach plans should accompany interventions with a primary measure of behavior change in the targeted population. True or false? Good. 75% as we near 10 more seconds. Thank you, Kelly. We got you. Okay, I will end the poll and we'll share the results here. There we go.
Great. Yes. So true is correct. It is. And I mean, I think that, we looked at this research and they gave us some great ways to start thinking about this. But yes, we should be thinking about behavior change, and we should be thinking about outreach and education as supporting in a targeted intervention. So these are the best practices. Okay, these are the things that I want you to remember. This, we went back to that. Those two points of the things I wanted you to remember is these best practices. So the information that we provide, it needs to be personally applicable, useful, easy to attain, have plenty of prompts with consequences of not changing behavior to be significant, okay? And we also have to realize the effectiveness of one strategy is limited. And so we have to have an array of outreach and education initiatives to accompany that intervention. We have to realize the effectiveness depends upon our ability to modify one or more risk factors, okay? That's important. We go back to look at those risk factors. How do we modify them? Employing social scientists to evaluate programs. That's so important. How can we be entrepreneurs and create change in our communities, but then show the effectiveness of that through empirical data that we can share with others so others can also create behavior change? We need to use behavior change as the primary measure, and we have to use a framework for planning. We can't just start and get to the end. We have to go through each stage and plan. We have to assess. You have to look for readiness. You have to do all these things in order to go through. And you know what? You may be in the assessment phase for a while, and that's okay, because you have to figure out who are the partnerships, and what are relationships that you need to develop in the community, or how do you even get the problem gambling team working together? Okay, so this is my last discussion point. And then I open up for any questions. I know that we have just a couple more minutes here, but I just wanted to ask again, what does outreach mean to you? And has, any of this changed maybe your thoughts or feelings, or helped reemphasize some of what you've already thought? I'd love to hear from you and any other questions that you have as well.
Yeah, and thank you, Alison, as we're waiting on some responses here. Great information. And where Illinois is right now, there's 6 new casinos coming, legalized sports gambling. Illinois has the most standalone, gambling machines, more than Nevada in the U.S. Racino's coming this way. I think community outreach, which I believe is the reason Kelly, came to us and asked, us to do this. And it's very important that it's done in the state, to raise the awareness levels, get the outreach going. So it's been great information. And
yeah, and Robbie, maybe this is where it needs to start.
Yeah.
Is how do we just raise the awareness of a specific targeted population, within our community? And maybe it's based on where a casino is opening up.
Yep. And, we just got a chat here from Marie. Yeah. The casinos are opening in 2 days. Thank you, Marie.
Oh, wow.
Yeah. And if anybody knows exactly where the legalized sports gambling is at this point, please send us a chat too, as far as specifically Illinois. But with all this, well put, Allison. I mean, this is a great starting point because I know most of our folks here, we do have an outreach network through the Department of Human Services with Illinois. So hopefully they're on the line, but all the clinicians on the line, just know that for us to get folks in, we need outreach at this point in time. And Allison, correct me if you feel I'm wrong, is much, I don't want to say more important, but it's very important at this point to get the word out now.
Yeah, I think
Before, yep.
now yeah, Robbie, I agree wholeheartedly. With even more expansion of gambling that's going on, it's even more important for us to have cross-sector collaborations so we know what interventions are taking place so we can help support them and make their interventions 100% more effective.
Right.
Because, you know, maybe they're just engaging in their intervention with forgetting that they need to even change minds and gain friendships. So
right.
We can go in obviously with knowledge on how to do that. So yeah, I agree wholeheartedly.
Yep. We've got some great texts that come in.
Yeah,
and if we're right at the hour, folks. If you have to leave us, that's okay. Allison, if you don't mind, just maybe a couple minutes staying on, because it looks like we've had a few texts.
Yeah, I can stay on for probably about 2 more minutes, but I have to get, I'm jumping on
No
another
worries.
call right after this too.
No worries. Okay,
so
guys.
I can maybe read a couple of these. I think it's important to remember that outreach is an important role in order to provide the best opportunity for those in need to get the services that will help them become healthier versions of themselves. Bridget Garlett. Sorry if I messed up your last name, Bridget. But yes, that's important. So well said. Kelly Zen, outreach is an initial step or foundation for the significant change of community members' behavior. Great stuff. You guys, great stuff. Let's see here. Slides will be shared, certainly. Outreach for us is presentations on our, oh wait, I'm sorry, I'm going the wrong way. Start now instead of later. Thank you. Learn more. Great, Ellen. Thank you for the feedback.
Yep. Oh, and thank you, Julie. Thank you for being on.
Yeah, thanks, Julie. Yeah.
Excellent presentation. Thank you. And I chatted my email address, so I'll have the slides. I can get them to you. The recorded version of this will be on weknowthefeeling.org. Allison, again, thank you very much. I think Illinois is right at the prime place for this to really, you know, we got to put our mind here with all the growth that's going to come our way, especially with COVID. Hopefully these cases are going to stay where they're at. And with saying that, though, more casinos are going to open and we're going to have more activity. So, Allison, thank you very much. And thank you for everybody that was on. Be checking weknowthefeeling.org for our next webinar, which will be scheduled somewhere around mid-July, or you can always reach out to me and I'll give you the information. Okay? Thanks, folks. Thank you, Allison.
Thank you so much.
Great job. Thank you.